All right, welcome to The Explainer. Today, we're diving deep into something most of us have been through, but maybe never fully understood: the respiratory exam. It's not just a quick checkup, it's this incredibly structured investigation, and we're about to break down exactly how your doctor plays detective. You've been there, right? You're sitting in the doctor's office, you've got this nagging cough, and you're just wondering, what is actually going through their head? What are they really looking for when they're listening to your chest?
Well, I can tell you it is anything but random. Think of your doctor as a detective. Your symptoms? That's the case they have to crack. Every single question, every test is a deliberate move designed to get to the bottom of the mystery. So, let's follow the clues together. So, where does a good detective even begin an investigation like this?
It starts with you, and I mean that literally. In medicine, the single most powerful tool is the patient's own story. Before a single test is ordered, the detective needs to hear what you have to say, because that's where the first and often the most critical clues are hiding. And they use a very systematic approach. It starts with what's called the chief complaint. That's the headline, I have a bad cough. Then they dig into the history of present illness, which is the full, detailed story. From there, the investigation broadens out. They look at your past medical history, family and social life, what you do for a living, and any medications you're on. Each step is like adding a new file to the case, building a complete picture. This part is all about investigating potential leads. Do you have a history of asthma? Does lung disease run in your family? Smoking is an obvious one, for sure. But what about your job? Are you around dust or chemicals all day? Even your hobbies, your pets, or a new medication you started. Any of these could be the key that unlocks the whole case.
Okay, so once the detective has the backstory, it's time to zoom in on the specific signals your body is sending out. These are your symptoms, the hard physical evidence of the case. And these are usually the first big clues. Things like a cough, coughing up sputum, feeling breathless, seeing blood when you cough, a wheezing sound, or chest pain. Every single one of these is a vital piece of evidence that points the investigation in a very specific direction. Let's just take the cough. It's not simply that you're coughing, it's how long you've been coughing that really matters. A doctor will immediately place it on a timeline. Is it acute, lasting less than 3 weeks, subacute, hanging around for 3 to 8 weeks, or is it chronic, going on for more than 8 weeks? Just that one detail, the timing, is a massive clue that helps narrow down the list of suspects.
And here's why that's so important. An acute cough makes the detective think about things like a common cold, pneumonia, or even a pulmonary embolism. But a chronic cough, that brings up a totally different list of possibilities, like asthma, COPD, or even a side effect from a drug. And if the cough is mainly at night, well, that's another set of clues pointing towards things like postnasal drip. See how it works? All right, here's another key clue: dyspnea. It's a fancy medical word, I know, but it just means feeling short of breath. But again, for our detective, the details are everything. When did it start? Is it all the time? What makes it better or worse? The answers to those questions help sort through dozens of potential causes. And then there's this one: hemoptysis. This is a big one. It means coughing up blood. Now, this clue immediately raises the stakes. It's a serious signal that demands a really careful and thorough investigation to figure out exactly where it's coming from and why. So, the detective has the story and the first round of clues. What's next? It's time to get hands-on with the evidence. This is the physical exam, where the doctor uses their own senses to find physical proof. The physical exam follows its own clear 4-step method. It kicks off with inspection, which is just looking. Then palpation, which is touching and feeling. That's followed by percussion, which involves tapping. And finally, auscultation, which is listening, usually with a stethoscope. Let's see what each of these techniques can uncover. You would be absolutely amazed at the clues a doctor can find just by looking. Sure, tobacco stains are pretty obvious, but what about finger clubbing, where the shape of your fingernails changes? That can be a sign of chronic lung disease. A slight tremor in your hands could actually be a sign that your body is holding on to too much CO2. A bluish tint on your lips, that's central cyanosis, a sign of low oxygen. All visible clues that add to the puzzle. Next, the detective starts tapping on your chest. And you might be wondering, what on earth is that for? Well, think of it like tapping on a wall to find a stud. different things under the surface make different sounds. A normal, healthy, air-filled lung makes a nice, hollow, resonant sound. But if there's fluid in there, like with pneumonia, the sound becomes dull. And if there's trapped air, maybe from a collapsed lung, it becomes hyperresonant, almost like a drum. And finally, the classic stethoscope. So what is the doctor actually listening for? Normal breathing sounds are called vesicular. It's a soft, gentle rustling sound. But it's the abnormal sounds that are the real giveaways. Wheezes are those high-pitched whistling sounds that suggest your airways are narrowed, like an asthma. And crackles are little popping sounds, almost like crumpling cellophane, which can mean there's fluid down in the small air sacs of your lungs. Okay, so now the detective has everything. They have the story from your history, and they have the physical proof from the hands-on exam. It's time to put all the pieces together and solve the case. And here's the bottom line. None of this is by accident. Your family history, how long you've had that cough, the color of your lips, that little crackling sound in your chest. Every single clue is a piece of the puzzle. And when they're all put together in the right way, they form a clear picture of exactly what's going on. I think this just sums it up perfectly. The history, your story, provides the narrative. The physical exam provides the proof, the hard evidence. And when you bring them together, they tell the complete story of the lungs. So the next time you're at the doctor's office, you'll know what's happening. It's this methodical investigation. All the clues are being collected, all the puzzle pieces laid out on the table. And the final question is always the same. What story do they tell? Thanks for joining us on The Explainer.